start of a campaign to make sure our hospital stays in public hands.
Fantastic turnout by our members, by the community, standing strong in opposition to the privatisation and the Americanisation of our public health system.
The government has done nothing to tell us what's going on. They haven't consulted any of us.
There's no guaranteed ratios. We may lose our entitlements. We've got a 2-year job guarantee, and that's not good enough.
Are we going to have that job security? Are we going to be able to pay for our mortgages, buy our homes, look after our kids?
What we do know is if we do get privatised, our services will be cut back.
The community know that this is happening and they don't want it.
Whose hospital is Wyong Hospital? Are we going to keep fighting? Yeah!
We need to stay in public hands so that the care will be provided to the patients that need it most, not the people who can pay the most.
Maitland Park today, signs of what the state government is up against over the city's new hospital. Those who work in the wards argue the private sector threatens crucial nurse-to-patient ratios.
We have negotiated with private hospital corporations in this state for a very long time, and our experience is that they completely reject the concept of patient safety delivered through nurse-to-patient ratios.
This proposal would leave Maitland without a public hospital, and even if, say, 85% of the projected beds were to be allocated to the public, which is highly unlikely, we would not even have the same number of beds as we've got now.
Premier Baird, if you think we're going to stand by while you Americanise our health system, you can think again.
But a recent backflip on the privatisation of another regional hospital has given protesters here hope.
My bed's rolled back on Goulburn Hospital. We see no difference between Goulburn and Maitland Hospital.
It's a very serious risk we take if we let the privatisation of hospitals go through in New South Wales. Of course, this is money for jam for the private hospital corporations who cough up minimal investment up front, use hundreds of millions of taxpayer dollars to build the new hospital, and then after 2 years they can cut expert nursing staff, cut entitlements, force staff to cut corners, then make a hefty profit once in operation. 40-year lease. The government says that it will give them a contract for 20 of those years to deliver public health care. And then at 20 years, somehow the public health system is going to decide whether it continues or not to have that public health system delivered out of that building. What's its choice? Has to go away and build its own building. What's the chance of that?
In the 7 weeks since this has been announced, we have had no word from the Health Minister, except to say we are not privatising. Well, people, if we're not privatising, and the Premier, the Health Minister and Mr Ward have said, if things go wrong, we can buy the hospital back. Who are we buying it back from?
What a lot of the community doesn't know is that Port Kembla is involved as well. This includes the after-hours palliative care service. How can I tell my patients, I don't know what's going to happen to you?
They are going to pick the services that are most profitable, not necessarily the ones that are going to serve our communities the best.
If you're a company, your first interest by law are your shareholders and their profits.
Gillian Skinner and Mike Baird, hands off our public hospitals.
The decision was made to ban greyhound racing, and we got to back down on that one. Well, we're going to get a back down on a more important issue: public hospitals, public health.
We must stand strong and we must fight back against the Americanisation of our public health system, against the privatisation of our health and other services in our community. We paid for them, we deserve them, we need them, they're ours.
Today we've come down by bus from Wyong. We want to be part of that debate at the gallery.
Nobody is going to spend $200 million and run a hospital for 40 years and not make any money. And the government says to the community, oh, trust us, it's not going to cost you any more, it's not going to cost any more. Well, it is.
This is my patients that I'm talking about, and I am so concerned about what's going to happen with this.
In my community, I want one hospital that serves every single constituent, whether you're a public patient or you're a private patient, and that's what my community deserves. Yeah.